So I'm Lauren. I work in the Bariatric and Metabolic Institute with these three awesome surgeons here, Dr. Bledsoe, and Dr. Fuller, Dr. J.G. Tucker. So the prevalence of obesity continues to rise with time. So here are some graphs that show just how quickly that it is growing. So you can see by the top graph there, that's mostly green, that was back in 1995. And then we jump 10 years and the graph significantly changes. A lot more yellow and orange colors there. We jump 5 more years and even darker colors, so the prevalence is just worsened. And then in 2014, you can see there's lots of red. And then this other picture is from 2019, and the dark red shows that the obesity rates for individuals is greater than 35% in those states that are dark red or dark maroon there. So it's a growing issue here in the U.S. for sure. According to the CDC, some of the top medical conditions in the U.S. are heart disease, stroke, and diabetes. And being obese only worsens those conditions. So if we can fix the root of the problem, then we can also fix those medical conditions as well. Patients that have diabetes or a BMI greater than 40, they need this surgery to improve their health, not just for weight loss. So yeah, fixing the root of the problem could help improve the health of individuals over the U.S. This next slide here lists many diseases that are worse that are caused by obesity, including pulmonary disease, obstructive sleep apnea, fatty liver disease, gallbladder disease, and some gynecological abnormalities, including infertility, PCOS, arthritis, some skin issues, gout issues, stroke, hypertension, coronary heart disease, including dyslipidemia, diabetes, and hypertension. Also pancreatitis, some cancer, and phlebitis. And so also with the rise of COVID, we're definitely seeing that obesity plays a huge role in that too. And so curing the issue of obesity can help prevent and lessen the effects of these diseases for sure. Living with obesity is costly, life-threatening. It decreases individuals' quality of life. It can be multifactorial, progressive, genetically related, behavioral related, environmental related, and it can definitely be difficult to overcome. Arkansas is the lead, or the third leading state, ranked in obesity. So it's definitely a concern here for us.
We are always leading in the bad stuff.
I know it. This report here that I found also shows, that obesity is affecting the rate of heart attack, stroke, and diabetes, not just affecting the patient's waistline, but also affecting their wallet. So obesity-related illnesses are costing billions in healthcare. So putting a financial burden there for sure. So why have bariatric surgery? I narrowed it down to these 3 main reasons. So first we'll talk about improving your health. Patients can decrease their medications with this surgery. They can get off of blood pressure medication, diabetic medications, arthritis medications, improve their A1C, improve their blood pressure, their blood sugars, their cholesterol, improve their neuropathy, have less edema, and less overall pain. So, patients come to us and they have back pain, knee pain, joint pain, and this helps them with that. So, also can improve their liver function, cardiac function. They can breathe easier, get off of the CPAP machine. They're no longer in the morbidly obese category, and so that reduces their risk of many risk factors, such as heart attack, cardiac events. Improves their health and adds life to their years to their life. So those are some of the ways that it improves their health. Also, improve their mobility. Patients have reported so many things to me in the last few years working in bariatrics, but being able to tie their shoes, things that we take for granted, being able to walk without being extremely short of breath and having to take breaks, not having to use their walker, their cane, their wheelchair, being able to cross their legs, things that a lot of us take for granted, being able to jog again, run, hike, ride a bicycle, play sports, run in 5Ks, and even marathons. And I even have a patient who's competed in an Ironman competition, and so there's just so many things that they can participate and do. Also, something else that we might take for granted and have improved their hygiene, being able to reach all areas of their body. So many things. Sit in a regular sized chair, sit in a booth at a restaurant, be more independent and not have to rely on their family. So those are some ways that we improve their mobility with this surgery. Also improving their quality of life. And so that's another one that we might take for granted. But being able to go on vacation, go to amusement parks, go to Disney World, ride a roller coaster, being able to fly in an airplane without a seatbelt extender or having to buy 2 seats, just things like that a lot of us don't think about. Being able to ski, something that they may have never done before or may have done when they were in high school or college but haven't done in years. So lots of non-scale victories for our patients. Being able to go shopping and find their clothes easier, play with their children, their grandchildren, do chores around the house. Some of our patients may have to hire someone to cook or clean or do their yard work because they're not physically able to do it. But after this surgery, they're proud to be able to do those things again. And so that's always a good thing to hear. Have more energy, improve their personal relationships as well. Spend less money on medications, doctor's visits, hospital visits, feel more comfortable in public, be able to go to the beach, something that they may have avoided for many years until this surgery. Sleep better, enjoy life again. Their weight's no longer holding them back. So those are all the reasons why to have bariatric surgery. These are some comorbidities that can be improved or resolved after bariatric surgery, including migraines, depression, sleep apnea, asthma, fatty liver disease, reflux, PCOS, urinary stress incontinence, arthritis, venous stasis issues, and gout. So with this surgery, 95% of our patients report an improved quality of life, and there's an 80% or 89% decreased risk of mortality in a 5-year period after this surgery. So once again, reasons why this surgery is needed for a lot of our patients. So what are qualifications for bariatric surgery? This depends on insurance. And we have an insurance liaison who can help assist anyone. If you have someone in mind, a patient or a family member or anyone that you think might benefit from our surgery, and you want to know if they qualify or not, just contact our office. We can help walk you through that. But just generally speaking, a patient, if they have a BMI of 35 or greater with certain comorbidities, then they qualify for surgery. If they have a BMI of 40 or greater and no comorbidities, they qualify for surgery. And then there are some ways that patients can qualify for surgery with a BMI less than 35 with or without insurance. We just need you to send over a referral. We can check that out, but you can consider cash pay for that. But insurance will cover with a BMI greater than 35. So send us over a referral if there's any questions about that. Also, the patient must be able to cognitively understand all the things that we're asking them to do as far as the diet, compliance, vitamins, and regular follow-up, and no history of any kind of addiction to drugs or alcohol use, any of those issues, and that way they would be qualified for surgery. So surgeries that we offer here at the Heart Hospital, our surgeons primarily perform the gastric sleeve procedure, and you can see here from this picture that that's removing about 75% of the stomach and not changing anything else. So we're just reducing the size of their stomach, and which leads to the reduced size causes a restriction, and so that leads to weight gain. And then the other surgery that we do also is the gastric bypass procedure, which there's restriction and malabsorption because of the rerouting of the intestines. We recommend the sleeve procedure for the majority of our patients unless there's a medical reason why they need the bypass procedure, and that can be discussed at their visit with the physician. So they'll, together with the patient, determine which surgery is best for the patient. So those are the two surgeries that we do here at the heart. As with any surgery, there are risks involved, and I listed those here. But things that we worry about mostly after surgery are bleeding, of course, infection. Patients are at risk for blood clots, heart attack, stroke, all of those other risk factors with any surgery. But they can also have a leak because we're cutting the stomach, but that's something that there's a very small percentage of that to occur, and we take all precaution before closing the patient up to make sure that that doesn't happen. But there is a risk there for that. There's also a risk for damage to abdominal organs that are close to the stomach, and so always want to be watching for this when you're caring for our bariatric patients. Preoperative care. So there's some requirements that the patient has to go through prior to surgery. Our patients have to follow a liver shrinking diet, which makes it easier to access the stomach at the time of surgery. And so we'll guide them on when to start that and what that entails. And then 2 days before surgery, they'll start a clear liquid diet, and they'll continue that 3 days after surgery as well. There's bowel prep that they'll go through as well for surgery. We hold NSAIDs and blood thinners, immunosuppressants, and vitamins prior to surgery as well, and we'll direct them and instruct them on when to stop those medications. All patients must meet with our dietitian and our exercise physiologist and be cleared by our psychologist as well before surgery. And if they're smoking or using tobacco products, they have to stop that as well because of the risk of blood clots. After surgery, there's a lot more detail to the post-op instructions because of the diet change and the restriction. So we'll go over a few of these, but they are all in your notes here. But they have to meet a 30, if you're ever caring for any of our patients after surgery, they have to get 30 ounces in prior to being discharged. Number one reason for our patients being readmitted after they go home is dehydration. So getting in their fluids is important. Continuing their IV therapy up until the time of discharge is important to help our patients get that head start on fluids. Their stomachs have just been operated on, so they don't feel good, they don't feel like drinking, they're nauseous, they don't feel great that first few days after surgery. So giving them the IV fluids can really help them stay feeling well and get feeling better faster. And walking hourly is important, or more. That helps prevent blood clots and lung complications, it helps get the gas and air that we put in their stomach at the time of surgery, checking for the leak, gets all of that out and helps prevent the trapped gas pain. So we definitely want to encourage them to walk. They're sore, they're hurting, let's give pain medicines as scheduled, remind them of that, they're not thinking of that, and so make sure that you're administering their pain medicines and nausea medicine so that they can get up and they can drink their water. Because those are the two big risk factors that we watch for after surgery. Wear their compression hose, that greatly reduces their risk of blood clots as well. Got to get in 80 grams of protein is what we want to push for. So that's going to help them heal and meet their nutritional needs and feel well too. So things that you don't want to have after either one of these procedures is no sugar, you don't want to have any liquid calories, and no carbonation. All of that causes discomfort, and so that's important. And then once they progress to get off the liquid diet, then we don't want them to drink 30 minutes before or after their meals, and so that causes nausea and can lead to some vomiting if they drink too soon, and so we don't want that. No straws or caffeine for the first 6 weeks after surgery. Caffeine is a diuretic, dehydrates you, so we're working against their ability to get in fluids and hydrate, and straws put a little bit of air or gas in your tummy, and we don't want that because that hurts and causes some discomfort too. Encourage them to eat slow, chew their food well, no snacking between meals, and they have to eat 4 small meals a day because their portions are so restricted that in order to get in their protein and all their nutrition, then they have to do the 4 small meals a day. And so that's lifelong. Then lifelong, they'll want to follow a low-carb diet and exercise daily. They will have a nutrition guide, and if you're on our floor caring for our patients, there should be a nutrition guide there at the floor as well for you to reference if patients ask you questions that you're not sure of. But if you can't find the answer to that, we're always available and we can help answer those questions too. We also have a BMI support page that has recipes, updated information. The patients are aware of that and have that resource at their fingertips too.
Is that Facebook?
It is. Yes, it is. Okay, and then more on post-op care here. These are things more in detail. After surgery, we stop their blood pressure medicine, their blood sugar medicine, so we want to monitor their blood pressure, their blood sugar if they have diabetes and hypertension. And usually we have them check 4 times a day. Write that down and then follow up with their PCP within the next week and just make sure their PCP or their cardiologist or endocrinologist is okay with what we changed and that they don't want to start them back on anything. The patient follows up with us 2 weeks after their surgery, and so we will check blood pressure and see how their readings are when they bring those in to us as well, and we can alter medicines if they haven't seen their PCP for some reason. Diabetic meds should be held unless their blood sugar is elevated, and our team, you guys, caring for our patients, can report that to us as well, and we can treat if needed. But most of the time, patients' sugars are running good because of the diet that they're on, and they don't need these medicines, and so we certainly don't want them to become hypoglycemic and have an episode of any of that. As well as blood pressure medicines should be held unless their blood pressure is running high. Blood thinners are held 3 days post-op unless otherwise instructed, and that would be in their chart as well. Hormones, including birth control, immunosuppressants, are held 4 weeks due to the risk of blood clots. NSAIDs are held as well, and typically at their 2-week follow-up visit we'll tell them when or if to continue those. We try to use those very sparingly and as little as we have to because of the risk of ulcers and bleeding, and so we don't want to irritate the lining of the stomach. Patients should be sent home with 4 medicines, and they're listed here. A PPI to protect them from getting an ulcer after surgery, Zofran for nausea, because obviously they're having some issues with that after our surgery, and stool softeners to help with the pain medication and help them with the change of diet because they're taking in all this protein that binds us up, not a lot of fiber because they don't have room, so constipation is common after this surgery. And we also give them something for stomach cramps or spasms, and so those are medications that they are sent home with. They must be compliant with the vitamin regimen and the dietary restrictions in order to be successful after surgery. This is more detailed information about the diet progression, what the clear liquid entails, the full liquid, stage 3 and stage 4, and then the maintenance stage of lifelong diet for our patients. And so you have that there. And if ever any questions, like I said, you can reach out to us and let us know. Why diet progression is important. So, compliance with nutrition, with our nutrition plan, allows the stomach to heal, decreases the risk of staple line leak, decreases the risk of vomiting from overfilling, which we don't want because that stomach has just been operated on. So we do not want our patients throwing up. That's not a normal occurrence, and if that's happening, let our team know about it. It also decreases the risk of cramps and spasms and nausea and discomfort, pain. And so those are things we don't want our patients to have to deal with post-operatively. Also, after surgery, the patient has to learn their new full point and how to not overfill it and what it feels like, in doing so. So our nurses that are caring for our patients after surgery, are kind of there to guide them in that direction too, and encourage them to take baby sips of water, baby sips of their broth, and their sugar-free Gatorades to get in their electrolytes. And so sip slowly, and just report any issues if you're concerned about anything post-op. Foods high in sugar can cause dumping syndrome. This is more common with our gastric bypass procedure, but dumping syndrome where they have the diarrhea, and so we don't want our patients having that either because that dehydrates them. So yeah, we don't want them to have anything with sugar in it and after surgery. And like we said before, straws allow air in the stomach, which causes discomfort, so avoid that for 6 weeks after surgery. Certainly do not want our patients to have any bread, rice, pasta, anything that can cause some swelling once it gets in there, because that causes discomfort for sure for our patients. and increases the risk of a staple line leak. Patients lose the most weight in the first year, and so dietary compliance is crucial for them to be successful. All right, these are a list of symptoms to report if your patient has any of this after surgery. These are the big ones. So if they're having fever, we definitely want to know about that. Tachycardia, definitely want to know about that. That can be a sign of a leak after surgery, so watch for elevated heart rate in your patients. Tachypnea, trouble breathing, low oxygen rates, we want to know about that. We do not want to send our patients home with those issues after our surgery. Low blood pressure as well is a concern. Decreased urine output, any bleeding really. They might have a little bit of drainage from their incision sites. That's typical, but if it's a concerning amount, definitely let us know. If they're bleeding from any other areas of their body, let us know. That's concerning. Abdominal pain that lasts, longer than 4 hours, that's concerning as well. The pain should come and go. It should be soreness, not constant pain. If it's constant, that is definitely a concern. And of course, vomiting, like we said, and watching for the risk of pulmonary embolism, staple line leak, bleeding, or obstruction. Those are our big concerns after surgery. Benefits of bariatric surgery. Most of our patients lose 60 to 80% of their excess body weight after surgery. So that's typically what we see. 65 to 85% of our type 2 diabetics have resolution or remission of this disease, and many other obesity-related conditions or diseases as well. Decrease or eliminate medication requirement. Decrease their health care cost and spending. And 95% of our patients report improved quality of life. Have an increased life expectancy here. The thing I hear the most from our patients after their surgery is the only regret that they have is not doing it sooner. And so I've had some patients, many of them tear up saying those words. So it's a good surgery that benefits a lot of our patients and helps improve their health, their quality of life. So here is a picture of one of our liaisons that works in our office. I know it. She looks so good.
Yeah.
So good. Many health benefits for her. She feels better. She has a 12-year-old son. Had this surgery several years ago. I think it's been 4 years for her now. But so it looks so much better. Able to get around. Just improved reflux. Like so many issues that have gotten better for her. And decrease her risk of a lot of things later on in life too by losing all that weight. And then here is a picture of our other liaison's daughter who just had surgery 6 months ago. She's only 6 months out, so she's got another 6 months of good weight loss ahead of her if she desires to lose more, but she's looking good as well. So that's just a couple pictures of some of our patients that have gone through this bariatric surgery and improved their health. Okay, in summary, patients can improve their health, decrease the amount of medications that they use, improve their mobility, and enhance their quality of life. Certainly contact your bariatric surgeon, myself, or anyone on our team if there are ever any questions or concerns about a patient. You can reach out to me on the ping. If you guys have ping set up, you can ping me and I can get back to you that way. You can email me, and also my cell phone should be at the bariatric pods as well. And you can call my cell phone at any point. I'm in clinic every day, but you leave me a message and I'll call you right back as soon as I get out from a patient's room. So bariatric surgery is a tool and it's not a cure. So, if patients don't use it correctly or properly, then it may not be successful for them, but the majority of our patients do very well after this surgery, and they want to stay healthy, and they don't want the weight to come back. So we appreciate all you do to provide top-of-the-line care for our patients here at the Arkansas Heart Hospital. Thank you.